Over alternatives to some of the treatments that the maniacs at LenapeValleyFoundation like to prescribe. Now, I want you to be understanding here. As far as I know, I don't think anyone at LenapeValleyFoundation has ever ordered a lobotomy in the past 40 years or so. Doesn't mean they haven't. It just means I don't think they did. I'm sure if they thought they could get away with it, they would. So, lobotomy is a surgical procedure performed on the brain. The brain has several lobes, each with different functions. The frontal lobe was the part of the brain targeted in the standard lobotomy operations practiced in the 40s and 50s. This surgery consisted of making holes in the skull, removing some brain tissue, and severing the connections between the frontal lobe and the thalamus. So keep that in mind. This is literally removing part of the brain. This was thought to make somebody get well. Okay? That's how crazy these people were. The procedure was pioneered by the Portuguese scientist Egas Muniz. Tens of thousands of lobotomies were carried out in some countries to treat schizophrenia, affective disturbance, and obsessive-compulsive disorders. Muniz was awarded the Nobel Prize in 1949. What is a lobotomy? A lobotomy is a surgical procedure to provide relief to people with mental illnesses, unresponsive to standard treatment. This method was pioneered during the 1940s and 50s when treatments for psychiatric disorders were few, chiefly insulin coma and electroconvulsive therapy. So they weren't right then, but they want you to believe they're right now. Okay? So, now before I continue, I want to remind you I'm not a physician. I am not an MD. I am not an ND. I am not a DO. I am not a chiropractor. I am not an LPN. I am not an RN. I am not a nurse practitioner. I am not a nutritionist. I am not a dietitian. This video does not constitute medical advice, okay? If you have a medical concern or a medical question, seek the advice and counsel of somebody with a medical degree and a medical license. I am not such a person. So a lobotomy was used to treat these patients. The operation aimed to sever the nerve fibers between the frontal lobe of the brain and the thalamus. The thalamofrontal radiation. Many methods were used, including brain cannuloleucotomus, chemical injection, electrocoagulation, and destructive ultrasonic waves. Gotta love that. Destructive ultrasonic waves to destroy portions of the brain. Now, I want to remind you, this is not to destroy tumors. This is not to destroy cancer. This is to destroy healthy brain tissue that these people believed, not proved. There was no proof that this was what was causing these issues. They believed it was what was causing these patients' issues. And when these operations made these people effectively mentally defective, they considered that a success. So by today's standards, these surgeries were primitive and dangerous. But a large study in the U.S. found that 44% of patients were released from hospitals after the surgery. Yes, because they were no longer disruptive. They're not telling you about the care they needed to be under as a result of these surgeries. Similar good results were reported by studies in Canada and England. What does a lobotomy do? Okay, during the 40s and 50s, lobotomies were performed, 1940s and 1950s, they were performed to treat patients suffering from mental disorders. For many years, some conditions treated by lobotomy included OCD, severe depressive illness, psychosis, schizophrenia, manic depressive psychosis, chronic neurosis, psychopathic personality. A lobotomy disrupts the connections between the frontal cortex and the brain and the rest of the brain, particularly the thalamus. Okay, doctors believed that doing so, believed that doing so would reduce abnormal stimuli. So they thought that by destroying normal stimuli, they would reduce abnormal stimuli. So keep that in mind. By disconnecting a portion of the brain from the rest of the brain, they believed that they would reduce abnormal stimuli. By destroying normal stimuli, by destroying the normal function of the brain, they believed that they would reduce abnormal function of the brain. Think about that. So, such stimuli were thought to cause impulsive and violent behavior. A lobotomy would make the patient calm and docile. It would make them docile. Lobotomy history. Lobotomies were pioneered in the 1930s, a time when mental asylums were packed with men and women. Effective treatments were few and many. Patients spent years locked up in crowded asylums through, though, a lobotomy. Now, what you have to understand is what has led to an epidemic of mental illnesses. These are apparitions. People didn't, if there is a genetic root to mental illness, how did everybody just magically become mentally ill in the last couple generations? Do you understand what I'm saying? Mental illness was very rare in the past. That's why it was thought to be demonic possession and evil spirit, because it was rare. It wasn't that common that people acted in these bizarre ways. You got to think about that. How did this come about? Is it the treatments causing the diseases, perhaps? The so-called diseases. The surgery involved removing a part of the frontal lobe, so it removed a part of the frontal lobe, a part of the patient's healthy brain tissue through a hole or holes made in the skull. Many people with depression and schizophrenia benefited. One of the pioneers was Dr. Walter Freeman, who started the procedure in the U.S. in partnership with qualified neurosurgeon, blah, blah, blah. Lobotomies, Okay, let's look at the side effects of this wonderful operation, okay? So operations on the brain are always risky. It's an exceedingly delicate organ and is easily damaged, often irreversibly. Several immediate and long-term side effects are known after lobotomy. Bleeding after the operation, brain infection and abscess, dementia, epilepsy. So, if you're familiar with a traumatic brain injury, imagine a traumatic brain injury from the inside of the skull. Intellectual impairment, disinhibition, and inappropriate social behavior. So you're getting an operation to correct disinhibition, inappropriate social behavior, and that, again, like with the medications, that's a side effect of the very operation that's supposed to correct disinhibition, impulsive behavior, and inappropriate social behavior, but yet it causes it. Epilepsy is a side effect of it. Apathy is a side effect of it. Incontinence, wetting and defecating oneself. Obesity is a side effect of it. Dementia is a side effect of it. Mortality is a side effect of it. Are lobotomies still done? Surgery to treat psychiatric disorders is still being done, but is vastly different from the classical lobotomy. Now doctors can precisely map. See, they want you to think that they know what they're doing, so they're doing this for psychiatric disorders. They are damaging healthy brain tissue. Now doctors can precisely map the functioning parts of the brain by imaging techniques like computed tomography, CT scans, magnetic resonance imaging scans, electroencephalograms, and other sophisticated methods. Just because they can do this does not mean that they're correcting any issues. The current techniques are called stereotatic neurosurgery. They're used to treat intractable pain, epilepsy, movement disorders such as Parkinson's disease, mental health disorders such as schizophrenia, OCD, and depression. Okay, now in the case of uncontrollable epilepsy or movement